Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This program will discuss aromatherapy. Hi, my name is Toni Gallardi. I'm a psychotherapist, talk show host, and writer. I've been working with people in adult transition and crisis for about 15 years. I did a talk show for 2 years called The Toni Gallardi Show that interviewed risk takers, people who had left chaotic lives and impassioned their lives with brand new vocations. And then I went on to start a book called Lifequake, which is all about a 7-stage map to a whole new way of being an adult. In this film, we'll be covering the art of aromatherapy. You'll be seeing examples of how it's used to treat emotional disorders, respiratory disorders, and circulatory disorders as examples. Then we will be talking about precautions in using aromatherapy, how it can't be used when women are at a certain point in their pregnancy, and how it can't be used for certain points in the menstruation cycle.
Like herbalism, aromatherapy draws on the healing properties of the plant kingdom. However, instead of using the whole part of the plant, aromatherapy employs only its essential oil. Essential oils taken from a plant are a very potent aromatic substance. This substance, extracted from tiny oil glands in the roots, wood, leaves, flowers, or fruit, is believed to house the healing properties of a plant. Aromatherapy essential oils may vary in price from about $20 to $200 or $300 or more. Like herbalists, aromatherapists concentrate on the benefits of the healing energy and the life force contained in each plant.
Aromatherapy is a very gentle yet effective form of alternative therapies. It includes massage, which most people know about, but it also includes other things like steam inhalations. For example, if you have a cold, then you put hot water into a bowl with some essence and put a towel over your head and breathe in the essence. It also includes things like burning oils through the diffuser, which is great for creating a wonderful smell or certain perfume. It also includes foot baths, sitz baths, and regular baths as well. Of course, there's the massage, which is blended with the carrier oil, usually almond oil, but not always necessarily almond oil. Then there's the burner, which you can just put several drops of oil into the burner, and there's no harm in that. You just keep replenishing the water levels as the candle gets in contact with the water heats up, and then it emits the aroma into the room. But of course the water level is going to go down, so you have to be careful about that. I usually put about six to 8 drops in that particular burner, and I find that with burners, if they have a small shallow dish, then it's going to heat up much more quickly than if you've got a deep dish. So I prefer diffusers that have or the burners that have a very deep dish, because it allows more water, and because there's more water in the dish, then the oil doesn't take on that really hot burned smell. A bottle, well, you would get, for example, say something like this. Obviously it's glass being much better than plastic. And inside you've got essential oil, which is extracted from plants. So it's 100%, it's botanical oil. And it may come from different parts of the plant. For example, it may come from the roots, or it may come from the bark, or the gum, or the leaves, or the flowers, or the rind of fruit such as orange.
Essential oils are highly volatile and evaporate readily when exposed to air. Aromatherapy essential oils, because of their high potency, are always diluted with a carrier oil when applied topically. A carrier oil blends with the essential oil, allowing it to enter the body. Carrier oils used in aromatherapy may include grape, safflower or sweet almond oils, wheat germ, olive or avocado oils, macerated calendula oil, or jojoba oil.
Essential oils are very, very concentrated substances, aromatic, volatile, oily substances obtained through various distillation processes from leaves, flowers, bark of trees, gums, resins. Now they're very, very concentrated. If you use them directly on the skin, there will most likely be a skin reaction, and they won't go very far. Quite practically, one drop of essential oil, will cover barely my palm. So to extend the oil, you use a base oil, and so generally, say to 10 ml, you'll have about 5 to 10 drops. We usually err on the side of less rather than more, but as a guide, it's about 5 drops to 10 ml of oil. And that allows the essential oil to be used over the whole body. The oils love other oils, so it will blend quite nicely with the carrier oil. The carrier oil itself is very important because of the various properties. Every carrier oil has its different properties. You can eat most of them, and they're also very beneficial to the skin. And what happens with the oils, massage is an excellent way of getting the oils into the body because the oil is very receptive, the skin is very receptive to receiving the oil. Because every cell in your body is made up of fat, the oils are attracted to other oils, so they are absorbed very readily into the skin. The oils are taken up by the body fluids, firstly the interstitial fluid that bathe and surround your cells of your skin, and then it's taken in variously into the bloodstream. And when it's carried around the body, it targets certain organs. And the oils are dealt with by the liver and the kidneys in the elimination process. So getting them into the body via the massage, you're warming the skin, creating a warm environment to help the oils soak into the skin.
The oils themselves, where they come from in relationship to the plant, can also be a very good indication. For example, rosemary is concerned with the head and the brain and thinking and memory, whereas something like sandalwood or one of the gummy or bark-oriented oils, then it's going to be associated more with the real physical, the grounding side of things. So. But yeah, there are oils for the kidneys. Juniper is a great oil for kidneys if you want to detoxify. Heart is rose, obviously. It's very, very gentle, very soothing, very loving oil. So we associate that with the heart.
Firstly, may I say it's very important that you have two things. Your carrier oil should be cold pressed, expeller pressed, which guarantees a certain quality. It hasn't been synthetically produced, it hasn't been extended, therefore the effect on the skin is going to be a lot softer. You're not going to have anything else tainting the oil. For instance, avocado oil should not be clear, it should be quite a green colour. And okay, so we're talking about sweet almond oil is a very common oil. Grapeseed oil, you can use sunflower, safflower. Apricot kernel oil is very, very good for the face, very good for dry skin, as is avocado oil. Rosehip oil, even olive oil, as long as it's extra virgin, cold pressed, is very good. The smell tends to put people off, but it's still excellent. There's nothing wrong with it at all. But you must be sure of the source of the oil, how long it's been on the shelf, that sort of thing. As far as the essential oils are concerned, they should be absolutely 100% guaranteed essential oil. They should not have been extended with any chemical extenders. You should be sure of the distillation process. Steam distillation, hydrodistillation is a very common one. But I'm not going to get into recommending certain oils. I'll leave that for you. But you must be very, very careful. You must be governed by smell and the price. For instance, jasmine oil compared to lavender oil is like 2,000 times the price. So you are not going, if you see it, as is rose oil, if you see a rose oil on the shelf for less than $25, $30 for a diluted amount, it's not the real thing. For the real, genuine, pure rose oil, you're likely to pay a good $100, $120 for 2 mils. Okay, so that's a guide, and also the more you smell them, the more you get to know the oils. The origins of aromatherapy date back many thousands of years. They go hand in hand with the practice of herbalism, the use of plants, trees, flowers for medicinal purposes. These would have been discovered quite by accident by people brushing against a plant, noticing an effect on their skin. With the invention of fire, they would have started burning different plants for fuel or for cooking, and gradually a knowledge of these things would have been built up. During excavation work, there have been discoveries of pots containing very, very minute quantities of fatty substances. One of the earliest, one of the more recent discoveries has been when Tutankhamun's tomb was opened in 1928. Some small calcite pots were found, and there was quite a lot of material in these pots, and it was analysed, and it was discovered that it was made up of about 90% animal fat, which had solidified, and there were very definite traces of, I think it was frankincense, and they say something resembling Indian spikenard, and the scent was still there. More recently, by the 18th century, there was work done in preparations being sold for medicinal purposes, but along with that went many charlatans and quacks that tarnished the reputation of these substances. So they didn't have a very good reputation. By the 19th century, more work was being done because of the advances in science, and what can I say? Generally by the French and Italian, because the French and Italian are very into the use of essential oils. By this stage, the essential oil was being extracted from the plant in various methods, very primitive, but it was there and being tested for its medicinal properties. Now, unfortunately, in the 19th century, because they had a lot more scientific knowledge, well, they decided to try and prove or disprove certain theories on these odoriferous substances, as they're called, the essential oils. And some proved, some weren't, and it was best to err on the side of caution. And so a lot of these oils were dropped from common use because they just weren't sure. I mean, they couldn't prove. So mainly the oils were used for flavouring and continue to be tested for their antiseptic properties. Fortunately, by the early 20th century, and where a lot more work was done, especially after World War I, Monsieur René Maurice Gattefossé started work on cures for skin cancer, gangrene, cures for bites from deadly snakes and spiders, that sort of thing. But with the onset of World War II, all this work was put aside, And there was another gentleman came to the fore during World War II, Dr. Jean Valnet. He discovered the use of things like eucalyptus and lavender oil for treating burns and wounds. And very simple oils, but very, very effective in an emergency situation. And he decided to continue the research after World War II. In more recent times, the French and Italian have been in the fore of research, discovering more and more ways of using these oils. And it spread out of France to the UK especially, and we do have a practice in Australia today. And various French and American scientists are working on further research. Still in the early to mid 20th century, a French lady called Madame Marguerite Maury further utilised the oils in massage, and she's written her book is still available today about the use of the oils in practical applications, and mainly through massage. And as I said, more work is still being done today, where even in Australia work is being done on various extraction methods for lavender and eucalyptus, which are we have some of the best oils in the world.
Well, the plants have a vibration, and I guess each plant has, I suppose, what you call a personality, different properties. So I would say that the body intuitively knows which oils it needs, because you will say, oh yes, I like this smell, or no, I don't like that smell. So if you're saying something like, well yes, I like this smell, it's a good possibility that perhaps your body needs the properties of that particular plant. And so therefore, you know, if you use the massage method, then you would have a body massage using that particular essential oil.
The massage works mainly on the central nervous system, which most massages do, of course, but the massage is also a very general lymphatic drainage. And so a lot of the moves are specifically to liberate the lymph and then flush it out of the body. So you do work along the spine, the spinal cord, and you do work clearing the lymphatic pathways. And that's what the massage, that's what the philosophy behind the massage is, to clear the body of toxins, stimulate the central nervous system, both, you know, exciting and relaxing, and trying to rid the body of toxins. As I said, it's very general. You do get proper lymphatic drainage done just on certain areas of the face, and that's of the body rather, and that's very concentrated. It's very general. People can feel a little bit queasy afterwards. We tell people to just increase their water intake and not be too worried about the feeling of queasiness. That's only the liver trying to deal with the toxins that have been released through the massage. Most people don't even feel that. Certainly a full body massage is very beneficial. When say someone comes to me for the first time, as it has happened with a lady has had a certain injury to her back, and quite severe. She's been checked out by a doctor. Massage is quite in order, so we've gone ahead. I did actually work for a good hour just on her back, and I didn't even touch the legs or the feet. It was considered better to work, and a lot of benefit was gained from that. But for someone that doesn't have a major problem, a full body is the way to go, because it's treating the whole body, and a lot of benefits are derived from that. Remedial massage tends to concentrate on a certain area, but the techniques are not as gentle. There's a lot of pushing and probing. You stretch and tapotement, which is the hacking at the end. Now, all that type of massage is wonderful for certain problems, but it doesn't invoke a feeling of calmness or serenity. Aromatherapy can achieve very beneficial results but the actual movements are more gentle but still very deep. There's no sudden movement, no sudden jerking movements. If we have to stretch or do any remedial work, it's done very gently and all the time talking to the patient.
I find that I am using aromatherapy more now than the deep tissue massage that I originally started with, because it has a much more subtle effect on the body and the body systems, and also on the mind. It is gentle. It provides a very euphoric and very safe manner of relaxing the body, stimulating certain areas if that's what the client needs. There are certain oils to balance the body, like geranium and sandalwood. Rosemary is a stimulant. There's antiviral and antiseptic oils like tea tree, eucalyptus. And many of the oils have varying qualities and varying effects on the body. And it's only through a study of these that you're able to work out a client's needs.
Each essential oil can be used by a trained aromatherapist to aid specific emotional, mental, or physical ailments which his or her client presents with. Emotional problems treated may include mental fatigue, stress-related anxiety, depression, insomnia, sex drive problems, or emotionally related headaches. Respiratory problems may include throat infections, colds and flu, or sinusitis, chronic bronchitis, and asthma. Skin and hair problems treated may include dermatitis, acne, or dandruff. Digestive problems treated may be heartburn, indigestion and flatulence, or diarrhea. Circulatory problems treated could include palpitations, low blood pressure, or high blood pressure. Muscular problems treated may be cramps, sprains, or rheumatism and arthritis. And gynecological problems could include PMS, menstrual pain, or irregular periods.
Probably most people have heard of lavender. Lavender actually is a very good all-round oil. It has the yin and the yang properties, as do all oils. Lavender can be used for insomnia. It's a very good balancing oil. It's also an antibacterial and anti-inflammatory. So, you know, if you have a burn, for example, then lavender is an excellent oil to be used for burns. If your skin is red from inflammation or some kind of dermatitis, then you can use the lavender. Also, chamomile is very good for inflammations of the skin as well. Then, you know, you can go into rose, which is a very, very beautiful feminine oil, and hence can be used for feminine disorders like the reproductive system, regulating periods, etc. It's also very good sedative oil, so if you're feeling a little bit stressed or anxious, depressed, then rose is also a very good oil to use for that. And then also there's tea tree, which is a great antibacterial, which can be used in cases of influenza, coughs and colds, etc., sore throat. Then peppermint is also very good for headaches. It's a very good stimulating, invigorating oil, so if you're feeling a little bit lethargic or a little bit sluggish, peppermint is great. Peppermint's also good if you're feeling nauseous. It will help calm the digestive system down. Lemon is a great cleanser, good detoxifying oil, as is juniper. If you want to detoxify your body, then juniper's great.
Firstly, go by smell. Do they like the smell or not? Secondly, of course, the advice goes hand in hand with being very sure of your suppliers, knowing what you want to use the oil for, be guided by the person. Well, it's a good idea to buy some books and read. Things like lavender oil, orange, lemon are very, very commonly available. They shouldn't be absolutely dirt cheap, but they're quite inexpensive and can be used for a variety of purposes.
When a client comes to me, I do a full history on them, check to see whether they're allergic to any oils and whether they have any contraindications, whether they're pregnant or have cancer, or, generally go through their medical condition first. And whether they have high blood pressure, because certain oils raise blood pressure, certain oils lower blood pressure. So I generally take a full case history, and then I will, within my own knowledge, I'll think, that oil will be good, but just to be doubly sure, I then go to my reference and I check it if it's a new oil, other than lavender, which I'm pretty familiar with, but if it's an oil that I think might be good, I will check that oil in my reference book as well. It would take many years of experience before I'm able just to take off the top of my head what oils to prescribe for everything a client may present with. I mean, some come with chronic fatigue syndrome, and they say that for Alzheimer's disease there are certain oils that they're experimenting with. So a lot of the oils, whereas they were used previously, or about 100 years ago, and have been well documented,
the oils are very powerful. They act on the limbic system in the brain, which governs our emotional state, and that's the area that will trigger a memory. Now, you might have had a very traumatic childhood, something that really upset you, and it was related to lavender oil. Now, lavender, most people like lavender. You might absolutely hate it because it's related to a memory, and that is a very common occurrence, right? I always ask people if they know that they don't like a certain smell. Generally, if people really, really don't like a certain smell, it's not going to be good for them, where it might be just wonderful for somebody else. Likewise, regardless of memory links, oils will have different effects on different people. For instance, Roman chamomile is extremely sedating, calming, soothing. I have a client who reacts totally the other way. It makes her hyperactive, she can't sleep. So that is very rare, but it does happen, and you don't really, though she might not have known that, and you wouldn't know that until the first treatment. So everyone's an individual.
Rappaport in 1971 has actually concluded in his book that all memories are associated with smell. It's like when a newborn baby smells its mother's milk. It might smell its dad who smokes. If it loves its dad, the smell of cigarettes will be what the child will like. In our day today, though, so many of the pure smells have been disintegrated by pollution of chemicals, and so it's essential that when you use the oils that you provide the environment which creates this beautiful entry to a person's mind and memory. The area of the limbic system is where the olfactory nerve transfers or translates the smell to the thinking part of the brain. And the area is around the brainstem where all the basic instinctual emotions such as love, hate, affection, anger, fear, all the emotions a human person has is triggered by a sense of smell. There are certain flowers that attract bees, the pheromones. So our sense of smell is really being delved into with an aromatherapy massage. Our memory, our body-mind programs. With an aromatherapy massage, you first start by obviously blending the oil for the client, depending upon what they present with, and warming your hands. And then you do what's called balancing. Your left hand is on their head, and you move the right hand down to the thoracic 5, and you rest your hand on this area. And you hold it for a count of 20, and while you're doing this, you are actually stimulating the solar plexus area. Next, the hand moves down to the bottom of the rib cage. But what you're doing is actually moving your hand down and stimulating various areas of the body as you move the hand down from the rib cage down to the lower lumbar and to the sciatic nerve. When a baby is formed in the embryo, you will find that the nervous system, all the organs, are formed at the same time as the skin. So by placing your hands on the various parts of the skin, you're also affecting the various organs. The next part that you do is to balance the head part, where you work up at the back of the occiput, and with the various pressure points, you increase the pressure. First on the left side you go with your right hand, and your left hand is balancing the right hemisphere, but your right hand is working on the left occiput. Then you change over the opposite way. So in effect, with your hands, you are balancing the right and left hemispheres and working on the whole area of the head, the bones, the nerves, the limbic system, the eyes, the sense of hearing, most of the faculties. Then you put oil on the back with beautiful effleurages, and you encapsulate the whole body. And you, starting from the bottom, you stimulate the nerves beside the backbone, all the way up, first on one side and then on the other. Then you sweep and drain the lymph, both sides. And then you do a special kind of kneading with the two hands, where you loosen up the toxins in the body, in that area, beside the backbone. After you've done this a few times on both sides, 3 to 5 times, you then sweep the toxins to the front of the body. Also, you relax the nerve. Then you move on to the lower lumbar area. And in this area around the lower lumbar and the gluteals, you're really getting to the basic part of the human body. You're grounding them. You're stimulating. It's more or less their contact with the earth, other than their feet, the bottom of the backbone. And you stimulate up the lumbar area and round the hip bones to the side and back again. There's also different meridians that you're stimulating, and also the lower areas, the sexual and creative areas of the person. Also, a lot of people sit down in their jobs. I mean, it also has a physical feeling to it as well. Then we do a kidney drain. That's where the fear instincts are. And you drain the kidneys. At this stage, you can even introduce another oil to your mixture, and you can use geranium in that particular part. You can use essential oils in topical areas where you find the requirement. After you've done that, you then move down to the feet. Now, with the feet, the main idea of the feet is balance, polarity, well, the feet and the legs, the acupressure meridians, and it's a mixture of stimulating and soothing. So it'd be stimulating, soothing, stimulating, soothing, and then balancing. You then go and wash your hands, because your hands up to your elbows, you've started from the positive top of the person right down to the negative feet of the person. Just as my hands have a positive and a negative, so also does the human body in different areas, positive being the head and negative being the feet. So what you do is you wipe off all the negative energy that you may have accumulated in your own aura as a healer before you turn them over and start on the head. On the head you, oh, by the way, on the feet, you don't press around the ankles of pregnant women, because you can bring on certain areas, you can bring on a baby. Also the endocrine system at the top of the head. You don't interfere with that with the people who have problems with their hormones or a woman who is pregnant. But going down the, more or less the part of the head, you work from the forehead down, and you stimulate the system. And more or less it's working on the area where the aromas are also breathed in and have a pretty vital effect on the memory of people. That's followed by, then you put the oil on your hands, and you work across the forehead, smoothing the forehead out, treating the area behind the forehead itself, that part of the brain, the sinuses at the top of the eyebrows, working your fingers across and down to the jaw. Every part of the face, you're draining the lymph and treating the pressure points. Then to finish, you just vibrate the aura. This is finishing the face. And it's just supplying energy, or a completeness to the head area. I feel that the head area is rather a sacred area. It's our computer, if you want to put it in terminology like that. But it's really the centre of our being. Then we move on to the lymph glands around the subclavian veins. And what we apply is more or less a lymph pump. When you push, the only way in which the lymph can move through the body is by breathing or by exercise. So what we do when we massage this area is to stimulate the areas of the lungs and also of the chest cavity. From there, we move down to the solar plexus, which is one of the spiritual chakras in that area. It's our connection with the people around us. It's where we get our gut feeling, if you want to put it that way. It's a little bit different to the limb system. It's our reaction with our gut, the solar plexus. So we treat the solar plexus, first of all, by balancing with the hands, and then encouraging the breathing in and the breathing out, and then vibrating on the out-breath. It's calming, and also it allows a person, when you're finished, to take the most wonderful breaths to fill their lungs. Then we work on, first of all, on the thymus area, which but in adults has atrophied, but you still stimulate that area. Round the thymus, round the liver, gallbladder, stomach, spleen, round the back to the adrenals, and then you're thinking of the diaphragm in this place when you're doing this, and you lift up, and they can expand with the breath as you lift up, and then you drain down to the inguinals. So as the person is taking the breath, I encourage them to mentally think of the healing energy. Thymus, which is really the middle of the heart there, middle of the chest, round the liver, stomach, gallbladder, spleen, to the adrenals, and then down. It's a beautiful completion of the centre of our body, especially with the solar plexus. When that's finished, we then move down to the feet. And the feet, it's more or less a finishing, again, a balancing, but a very, very gentle balancing and very gentle stroking. Again, persuading the lymph to go back to the main part of the body. And you always elevate the feet at the end to allow the lymph to drain.
Right, one of my ladies came to me, she was a nurse. She'd recently lost a brother through suicide. She had not been allowed to have any time off work. She had a rather severe supervisor. She worked at a nursing home, and she basically hadn't been allowed to grieve. And she really needed to release a lot of tension and be allowed to grieve. And consequently, she had a few physical problems just by the tension created by that situation. She hadn't released any of that. When I first, she came 3 times, and then after that, she was fine. You know, she didn't need to come back. Now, the first, I'll just read you from my card. First visit, she had a lot of tension in the neck, shoulder pain, rhomboid pain, which is in between the shoulder blade. She was suffering grief, obviously, and it was only a month ago. Now, for the full body massage, I did a full body massage, and then I concentrated on problem areas. And I gave her chamomile, Roman, geranium, and rose. Now, this was the lady that actually reacted to the Roman chamomile. And for the face, I gave her rose and geranium. Now, I gave her chamomile Roman because of its calming and soothing properties, and very sedating. She was having trouble sleeping. I gave her rose. It's very, very good in helping to express grief and loss. And geranium is a very, very strong, what we call female oil. It's very estrogenic, if you like. It has a very holistic effect on the body, and it reacts very well with rose and chamomile Roman. And because the faces are different, I wouldn't give her chamomile Roman on the face. I gave her rose and geranium just to help continue the process. When she went home, I gave her a bottle mixture for the bath of chamomile, rose and geranium, which I gave her for her body blend. Now, when she came back to see me the week after. She said she was sleeping. She was able to cry. She actually expressed that grief. She used the oils in the bath every night before going to bed. Her face was just, there was a remarkable difference. Before, she was quite tight and pinched, and her face looked beautiful, really, very relaxed and calm. She still needed to have another treatment because you really need to follow it up very quickly with another treatment. Now, I did notice less tension in her neck. Her shoulders are clear. Her rhomboids in between her shoulder blades, there was almost no tension at all. She had really done a good job on herself. She'd been able to release the grief. She did say the drops had kept her awake, so she didn't actually take them, which was actually very good. She was able to get in touch with her grief and express it without using the drops. She used them for a couple of nights and then just dropped them. But what she did do was use them through the day, and that helped her. So we talked about not using them at night, of course, which she hadn't done, and she continued the day use. At home, she had some sandalwood and lavender, and she used those, and they worked very well, which was fine. And so when she came to see me again, we changed the oils to sandalwood, rose and geranium. Just sandalwood replaced the chamomile roman, and acts quite well. It's still very sedating and calming, and kept with the rose and geranium. Now on her third visit, she was absolutely glowing. She was so relaxed. She was actually going to take some time off. She'd sorted things out with her supervisor at work, and there was a lot less guilt associated with not being able to see her brother before he died, and why did he do it. And she had very much come to terms with it. That was in 3 weeks, and she left quite happily. She didn't really need to come back.
Aromatherapy oils are extremely concentrated, therefore extreme caution should be taken, as some oils, which are never usually used by trained aromatherapists, may cause unpleasant reactions. All essential aromatherapy oils should be kept away from the eyes and from the reach of children. Certain oils can cause contraindications, especially during early pregnancy in women.
The precautions that I take, aside from the general contraindications with doing aromatherapy, is generally to keep away from the eyes and any of the mucous membranes, because it can irritate. Also, do not use oils heavy-handedly. Aromatherapists do know the blending factor. You can use up to 10 drops of oil in 20 mils of carrier oil, but you'd be a bit stupid if you use 10 drops of peppermint when peppermint only has a blending factor of 1 in 20 mils of carrier oil, because even though peppermint can be used to cure a sick headache or a bilious headache, too much of it will actually cause a headache. The same thing with ylang ylang. So the precautions I take is strictly to keep to the blending factor, which is the proportion of oil used to the 20 mils. No more than 10 drops. And in some cases I don't always use the full amount. Now, I'm quite allergic to citrus oils, and I find even if I use the required amount of citrus oil as prescribed by aromatherapists, it is still a little too much for me. So always I keep a bottle of unblended oil, that is the carrier oil, so that if anyone shows a reaction to a particular oil, you can wipe it off immediately.
Mostly the oils all the oils can be used. The general public is told to err on the side of caution because they are capable of overdosing. And any reaction people have, apart from very rare cases, is usually through misuse or overuse. So anything that's going to stimulate the kidneys or the liver excessively, you don't use. Or if you're going to use them, you use a very small amount. It's like the homeopathic principle. Less is more if you're treating a problem. If a person has had hepatitis, for instance, you wouldn't use a blend of cypress or juniper, in great quantities. It's going to really overload the liver, because the liver has to deal with these oils, and you've got to be very gentle with an organ that's been through a trauma, basically. Now, other sensitivities is if a person is extremely fair, you stay away from oils like bergamot, which is extremely phototoxic. They could have adverse reaction to that. Their skin could, if they go out in the sun, for instance, it could change colour. Bergamot is used in a lot of tanning products. for instance, because if it's reaction with sunlight, it's very immediate. To a lesser degree, the other citrus oils will have an effect on the skin. And citrus oils, by the way, have to be extremely fresh because they do oxidize quite quickly within 6 months. And likewise, when you're using them, keep them in the fridge, don't leave the cap off for too long, keep them away from sunlight because of the oxidation processes involved. And they will certainly irritate your skin if they go off. So you have to be careful there.
So the oils are used in very, very small doses. If you overdose on the oil, then you can in fact produce the opposite effect. For example, if you're using an oil to help with a headache, for example, and you really overdose on that oil, you're in fact going to make that headache much, much worse. Also too, if a woman is pregnant, then it's very important to find that out before treating that client, because otherwise there are some oils which will actually induce a miscarriage. So one has to be very, very careful. Also, if a person is prone to epilepsy, there are some oils that can, in fact, bring on an epileptic fit. So one has to be careful with those. And in general, just be careful. They're very, very powerful. So just, treat them with care. They're not something that you can just put a few drops here and a few drops there.
Well, of course, the French know what they're doing, and they do prescribe oils internally. To be an aromatherapist in France, you have to practically be a doctor first and know a lot about herbalism. Now, we do not advocate internal use of the oils, regardless of what you read in the books. Now, that is a major precaution. There are other ways of using the oils via teas. Peppermint oil, for instance, via the whole plant, if you like, you can mix them up in a glass of warm to hot water. Can be used very successfully for nausea and tummy upsets. You're getting the therapeutic use of the oil as well as the whole plant, basically. Now, you can use peppermint oil, 1 drop, in a rather large glass of water because it can be very strong. Now, you'd sip that, you wouldn't drink the whole lot. Now, I just want to state quite categorically that we do not prescribe oils internally. Now, people who don't know much about it or have never had it will always think there's something slightly sleazy about it. But let's face it, there is someone that maybe you don't know touching your body. Some people are very uncomfortable about that. But if you, as a therapist, are aware that somebody may feel a little uncomfortable, it's up to you to put them at their ease and be aware that they might feel a bit strange, and just to reassure them. But human nature being what it is, there are always people that are going to think, there will always be people that think there's something slightly wrong about massage. But it's one of the most beautiful forms of healing, because you're basically being cared for, aren't you, and touched.
I don't heal anyone, but as a masseur, my fingers can find tight spots, areas in which people are blocked. And by drawing their attention to that and actually encouraging them to breathe into that tight spot, breathe the positive energy in, and on the outward breath, to let go any negative thought forms, ideas, feelings that they may have. So it's more or less getting into the rhythm of life, the breathing in and the breathing out. In many respects, a massage and an aromatherapy massage just prepares the physical body to be at rest and at peace, enabling the spiritual energy to take over.
It's best if these alternative, so to speak, forms of treatment are more complementary forms of treatment. A client can be treated quite successfully alongside having medical treatment as well as massage. They're not alternative, they're complementary. No, we don't say that you should do this instead of going to see your doctor, because they can work in quite well. There's no reason for them not to. Each therapy has its place. Aromatherapy is very holistic. It works on different levels. It relaxes the body, it clears the mind, it warms the heart. So you get a more holistic form of healing. Modern medicine tends to just treat one aspect of a problem.
I think it's becoming more and more accepted, and I think, the more people start to accept the fact that we can use our plants and all our natural resources to help us heal ourselves, then, the more it's going to be accepted as a therapeutic tool.
Well, as far as I'm concerned, I feel that it opens a wonderful world of smell, aroma, memory, body work, things that I and other human beings have forgotten. We've lost our sense of smell. And by encouraging that and the memories, the good memories associated with it, it would be a beautiful, euphoric, relaxing manner of receiving healing.
Increasing in popularity throughout the world, aromatherapy is beginning to become respected by orthodox medical practitioners. In the United Kingdom, numerous hospices and hospitals are now encouraging nurses to use essential oil massages on their patients. Essential aromatherapy oils are natural cleansers which can alleviate numerous emotional, spiritual, mental and physical ailments effectively and safely.